the opening day conference breakfast. We very much appreciate that. And I would like to introduce our keynote welcome speaker for this year's conference, Dr. Yasmen Simonian, and she's Dean of the Dumke College of Health Professions here at Weber State. She was born in Iran to an Armenian family, and she and her family immigrated to the United States in 1967 with the thoughts of achieving a better life and education. She earned her bachelor's and master's degrees in medical laboratory science from the College of Medicine and her doctoral degree in patient education and counseling from the College of Health at the University of Utah. She joined the Weber State faculty in 1981 and has served as the Dean of the Dr. Ezekiel R. Dumke College of Health Professions since 2008. In addition to chairing and teaching medical laboratory sciences, she and her colleagues pioneered the development and delivery of online MLS associates and bachelor's degrees programs. In 2005, she received Weber State's John Hinckley Award and was recognized as Utah's Professor of the Year by the Carnegie Foundation for the Advancement of Teaching and the Council for Advancement and Support of Education. She was the first female to receive the Weber State University Brady Presidential Distinguished Professor Award, and she was a fellow in the Association of the School of Allied Health Professions. It's my pleasure to welcome Dr. Simonian.
This podium's always too short for me. Good morning. There are not a lot of early risers. This is a early morning kind of a thing, and I thought everybody will be used to that. Welcome. I'm here to welcome you on behalf of our College of Health Professions and also Weber State University, and wish you a great conference. And I would like to let you know about the kinds of programs we have at our College of Health Professions, and also tell you a little bit more of what we do globally. So I have a lot of pictures, and we have timer here, so I can watch and make sure that I won't go over, but oh. That green. There are a couple of greens.
Yeah, sorry about that.
Oh, it's okay. Everybody calls us health sciences, but we have a program, we have a department called health sciences, but the whole college is called health professions. And we have, we're the largest college at Weber State University. We graduate the most, and we're proud of that. A 5-year total, in 4-year graduates, we have nursing is number 1. We're in the top 10 usually. Radiologic sciences is in number 2. Medical laboratory sciences is number 6. And health administrative services is number 10 on top 10 of Weber State University graduates. We offer stackable programs. That means you can get a degree and then go on and get another degree on top of that. The beginning of the, like the 2-year is beginning of the 4-year. So that's what it means, career ladder or stackable programs. We have face-to-face courses, and we have online courses, and we have some totally online programs that we don't ever see the students until they graduate, and then we honor them when they come through graduation. Our very first one was from Guam, from United States, kind of a based program right there, and that was many, many years ago that we did that. We have our newest program that was approved was Doctor of Nursing Practice, And this is the first doctorate program at Weber State, and we're all very excited about that. We have Master of Health Administration, Master of Nursing, Master of Respiratory, Master of Radiologic Technology, and recently, at July 1, we're going to get athletic training, which is a master's program. We all work together as a team. We have interprofessional education in healthcare. It's IPE. We have a building that's named after that. And we're working, our next project is Physician's Assistant Program, the PA program that we're hoping to start now and start accepting students in 2021. Our online program started because we had people who wanted education, but they couldn't come on campus. So we started online program, and we make sure they have access to hospitals and clinics so we can educate everybody that way. Athletic training is one of the first ones, and we're excited to have them because we've been doing undergraduate research with them and teaching with them, and now they're going to be housed in College of Health Professions. They're fun people, and we have dental hygiene, which we have about 18 different dental chairs that our students rotate on, and we accept patients. We take care of underserved and children's fluoride and a lot of different kinds of activities we do. We have a community connections with the VA hospital and the Midtown centers. As part of our interprofessional education, we have a research project that we have collaborated radiologic sciences students with our dental hygienists, and they use cone beam imaging, and they look at dental various issues with dental care, and they also can produce 3D models that they can work on. We offer continuing education courses for the workforce that's out with newer education that we have, and we partner. We just got funding to partner with University of Utah Dental School and our dental hygiene program to work together and exchange education and students. Our emergency health care is active and doing a lot. They have increased enrollment. They have added remote cohorts in Jackson Hole, Moab, Cedar City, Elko, Vernal, and more areas that we teach online, and then we go to the remote places and have the laboratory hands-on practice there. We graduated our first bachelor's degree in emergency health care, and they passed their national accrediting site visit greatly, so we're all proud of that. Our health sciences department provides foundation for all of our programs, and we have tracks that the students can go, like if they're interested in nursing, they take health sciences and the track in nursing or in medical laboratory sciences or radiological sciences. So we have that. We have a cohort from University of Utah Medical Center that are EEG technicians. It's a program that we can offer them with the Bachelor of Integrated Studies in neuroscience, in health sciences, and some other emphasis. It has 3 legs, and they have to have 18 credits from each area. So there will be 60 students starting from that. Health administrative services. We have health information management, health information technology, certificates. Our new program is public health, and they also have Master of Health Administration and Executive Master of Health Administration. This is our public health, our first BS degree in public health. We have also are working on post-acute nursing administration certificate. We are on the top 15 in the nation for bachelor's in long-term care administration. Number 2 in best online college offerings in health information degrees. We have so many awards in this department that there wasn't enough room and time to talk about it. So we're just proud. Number 17 for most affordable online offerings for medical billing coding certificates and a lot more. Medical laboratory sciences. They do a lot of undergraduate research, and what they have done is isolated macrophages from the municipal waste water that are specific for infecting Pseudomonas aeruginosa, which is a model organism that creates this biofilm in cystic fibrosis patients. And we're working on using antimicrobials to get rid of the film and help the cystic fibrosis patients. We just named our School of Nursing as Annie Taylor D School of Nursing, and we're really proud of that and happy with that. And the D is part of the McKay D Hospital. That's the same D family. Annie Taylor D was a nurse that started nursing in Ogden and doing that. There's her picture. And we offer bachelor's in nursing, master's in nursing, family nurse practice, and a doctor of nursing practice, which is the latest one. And that's the wall that's dedicated in our building, if you ever want to come and see it, in our 4th floor of Marriott Allied Health Building. Because of the many programs we offer in radiologic sciences, we designated as the School of Radiologic Sciences, and we hosted the first World Radiology Day here in the beginning of the year, and we had a lot of interest in attendees. School of Radiologic Sciences has created a bridging program with the military individuals who are in military who get training on the job but never get a degree. So we're offering degrees for completion so they can be more competitive when they are out in the field. And they can get jobs in whatever they've learned on the job training, and we give them education. So far, we have that capability, and right now we have a group at Fort Sam Houston in San Antonio talking to different programs to see what we can do with that, and that's coming. There are many military individuals at Fort Sam Houston, and that's their main medical education center. Respiratory therapy is started the first respiratory therapy program in China about 4 years ago, and we started it in Xi'an, China, and at this moment, they never had a respiratory therapist. They all had the physicians taking care of the patients, and we had the physicians come to Weber State and to study and shadow our respiratory therapists. So they became faculty, and they graduated the first set of respiratory therapy students about 4 years ago, about 70 of them. So they're now graduating 70 students a year. So we're kind of proud of that. We also have area health education centers for northern Utah, housed in our college. And we work with a pre-health science scholar program, and we have students from high school that would like to be in healthcare, and we provide opportunities for them to learn things and also mentor and share what they know in high schools. We use them as recruiters, and they get extra education in presenting at different places, and there are more scholars signed up to start. We do a lot of undergraduate research, which kind of sets us apart because it teaches our students teamwork. It teaches them how to do literature search, how to do IRB, how to get information, how to do work together, order things, watch things from the beginning, do the research, and do the presentations, and then send in for publication in professional journals. And that we've done a lot. But this one is from a couple of years ago, and our students were working on the CRISPR gene suppression using for superbugs that become resistant to antibiotics, and which is a big problem globally, and they work on that. So that was some of the problems we had. Here's another one, working with ability to modify the bacteria that's resistant to antibiotics that we can use differently. Okay. We have a new building that was dedicated this summer, and it's called Interprofessional Education, IPE, and it's Catherine and Ezekiel Dumke Foundation, and we just had the family. That's the ribbon cutting there, and if you come and look at the walls, all the bricks are made of if you look at it in 1 minute, you can see the respiration, the heart rate, the different, there's only 5 different items, and then what you're looking at right now, where we have the heart hats, that's the EEG pattern. It's a normal EEG pattern. I gave them the abnormal, and that would have been bricks all over the place. So this one is a normal EEG. I asked for an EKG, but they couldn't produce that with bricks, so we're looking into a sculpture to go in the grass to symbolize the EKG pattern. Here's the inside of the IPE building. It has 2 floors. We have 18 offices, 4 classrooms, and an area for students to study, think area, and also a balcony that we had our first barbecue there. We're trying to be more fun and be there for us, so you're welcome to come and share barbecues when we do have them. And where you see the ladies standing, those are the Dumke sisters and a couple of their daughters. The mural in the back is the first mural that we have at Weber State, and they were trying to find something that represents healthcare and all that. That's a pattern. If you do a bone marrow aspiration and stain it and put it, it's kind of like a rendition of a bone marrow. It's got the early cell productions, and it's pretty vivid. Students can sit and gaze at it and hallucinate cells if they want to, so it's pretty good. And so that's what we have. Another thing we do is we do lecture series, College of Health Professions lecture series, and we have experts in the field to come and give lectures, have an hour talk about the latest. We've had, in all the areas that we have majors in, or this is a good opportunity. If you would like to share your knowledge and your expertise, and you would like to come and give an hour lecture, we usually have about 500 students. And we also invite our healthcare community to come and listen and get continuing education. So please let me know. I'll stick around and see what kinds of things you'd like to come and share with our students. And so this is one of them. We've had oncology, we've had patients with breast cancer, we've had cardiology, we've had many different. We have a presentation on opioid addiction and what we do, and we had naloxone kits all over the campus, so in case we can help the students. So the sky's the limit, and you have my invitation, so let me know. We do a lot of community connection. We do help our underserved, and we have summer camps for where students can come and do hands-on in our labs and work with things, and so they can be interested in healthcare and see what they can do. Global. At this moment, we have people in China, people in Cambodia, Thailand, and Vietnam, and they're working with respiratory problems with infants, and also educating in infection care and whatever else they ask them to do. This is, if you've been to Shanghai, this is Shanghai and the Pearl Tower. It's beautiful at nights when you take a boat ride, and we take our students around so they can see. They say that the education you get here is important, but the kinds of things they get with hands-on globally, it's priceless. Not just the kind of healthcare, but the culture. Being able to be exposed to culture, they learn what to do, they see what the needs are, and they appreciate what they have here, which is really important. We love Chinese kids. Usually they run around and they're just as cute as they can be. This one is saying thank you. That's a hand gesture for thank you for, it says thanks for being here. And then we usually go to northern China, and we do a lot of community service. We're doing vitals here, and usually the whole city comes out. We're covered on TV with newspapers, and everyone comes out, and it's a good opportunity for our students to pair with the Chinese students who are international nursing students in Heilongjiang, which is in northern China, and they educate. We do CPR education, and we do vitals, and it's a fun thing. Everybody loves this. So we do that, and I did that a couple of days ago, in China, in Heilongjiang. Now they're in Shanghai. We are in Vietnam, and we're in Thailand, and this is in Ghana. We've started a respiratory therapy and medical laboratory sciences programs in Accra and Kumasi, Ghana. This is in Ethiopia. This is in Addis Ababa. And what we have done, this is healthcare, emergency healthcare. We have our department chair and department chair for health, emergency healthcare, and our physician helping with emergency healthcare. And what happened is this gentleman is a paramedic, and they didn't have they need help in Addis Ababa, and he needed ambulances and all that, so he sold his house and bought an ambulance so he can help people. So then our people went and taught them, and now they have 4 ambulances, and he finally got a house after, selling it, and they got some more information. So this one is in Abu Dhabi, in United Arab Emirates, and we have respiratory therapy and emergency healthcare there. We're helping them, and we're also helping them prepare for accreditation for the kinds of things they need to do. And this one is in Cambodia. That's one of our nurses, Julie Gee. She's checking all the lymph nodes and helping with the children's health, and they're still there. They will be coming back pretty soon. This is a picture from 2 weeks ago. And this is also in Thailand. Our faculty from nursing and respiratory therapy together got an award this year for a collaboration. It's a Hemingway Award that Weber State gives. And here is also in Thailand. This is in Sweden. And this is next. I'm going there in June to establish history of medicine, study abroad there. And these are some of the future things that we're doing. And this is the Chinese kid saying bye. So thank you very much for your attention and the opportunity.
Perfect.
How's that?
That is absolutely marvelous.
Thanks.
Brian Campbell, Dean,
That's-
thank you so much for
Thank
your
you.
time.
Thanks. I'll be around if you have any questions.